Live now to Ottawa. This is Foreign Affairs Minister François-Philippe Champagne speaking about the coronavirus outbreak. Let's watch.
Obviously, we are in the middle of the night in China, so we will be contacting those people to find out exactly what their needs are. And of course, we can get back to you once we have further details. And we've consulted our allies and have checked out the options.
Yes, sure. So I was just saying, so this morning when I talked to you, the situation is that we have 250 Canadians which have registered on the website of Global Affairs Canada, which are in the province. Of the 250, we have 126 which have requested consular assistance for our assistance, obviously. And so we're looking now at contacting them. As you appreciate, it's the middle of the night in China. We are in contact with them. We're trying to contact everyone, assess their specific need for assisted repatriation. We're at the same time consulting with our allies and looking at the different options that people are considering, also in contact with the Chinese authority. But as I appreciate, because it's the middle of the night, this is the details I have for now. We're looking at all options to assist them. That's our priority, but we'll come back to you when I have more. At this point of time, this is the information that I'm giving.
Will you repatriate them? Now, what we end up doing will depend on the needs that are identified, and that's why we are currently looking at the various options. Of course, there is the option of repatriation with an aircraft, but there are also other options that we are considering. And once we have done that analysis, we will come back to you to give you further details. Well, there are various options that our allies are reviewing. There are some countries that are proposing various solutions to bring back their citizens. So we're in contact with them, and once we have additional details for you, of course, we will turn to Canadians to provide that information. Well, in terms of the options, there are two options. Either a country sends a plane to bring back its citizens, or a country can participate with other countries to have some spots on an airplane. And the repatriations obviously have to happen via air. So we're looking at the different options to provide consular services for Canadians. We're consulting. We're looking at all the options, but as we're in the middle of the night in China, I can't give you additional details because we haven't had a chance to speak to each of the individuals who have asked for help to find out what their circumstances are and what is the best solution for them.
250, 126 you've reached out to. Are you sending planes? Yes.
I'll repeat what you're doing. Exactly. So what I was saying is that, as we said this morning, the latest number that I have, because I think Canadians watching us should understand it's a dynamic situation. We encourage Canadians to register on the website because that's the best way for us to inform them as quickly as possible about recent developments. So what we have now, of the 250 Canadians who have registered, 126 have signified their wish for assisted repatriation. Because it's the middle of the night, we're trying to contact everyone to assess their each individual needs. We're looking also at options with different nations. As you know, different nations are looking at how they can repatriate these people back to their countries. That's the consultation we're doing right now. We're looking at all options to provide the best consular service we can. And we will come back to you as soon as I have more details, because you appreciate we just finished cabinet. We had that. I need to go back, make sure that I have the latest information so that we can come back to you in due course.
Are you talking about sending a plane or hitching lines?
And are these people that are in quarantine type areas, or they can't get out of the cities, or is it because they are sick that they're reaching out to you?
So maybe I can take that question. Quite frankly, we don't know yet what the situation of those individuals are. As Minister Champagne has indicated, that's part of the process, to reach into, to speak with the individuals to find out what kinds of situations they're in, what their needs are, and and assess from that space what kinds of help we could provide. I will also say that part of the risk to travel to that area is not necessarily about contracting the coronavirus, but really, quite frankly, the strict quarantine the entire region is under. So, for example, people that are visiting to that region or traveling in that region may be having a hard time accessing supplies that they need. They may be having a hard time getting around the community. They may be having a hard time moving from one region to another. They may have family in other areas that are isolated. So this is the work that he will be doing with his team to assess exactly what kinds of supports the Canadians that are reaching out to us need.
But when you talk about repatriating people who say they want to be repatriated, are you talking about sending a plane? Or are you talking about charters, getting them on, say, a British plane or an American plane?
I would say,
what are we talking about?
exactly. All options that you said are on the table. We're just looking at the most efficient way and talking to them first to understand. The minister was very clear. We need to understand their medical condition, their specific wishes, but in order for us to have a tailored response to the Canadians which are there, which are seeking assistance, we do need to talk to them, assess their condition, and on the basis of that information, we will tailor our response in accordance with the
But
needs.
if a Canadian wants to come home, you are saying you will get them home.
What I'm saying at this stage is that every Canadian which has reached out to us for consular assistance will receive it. The way we will deliver the assistance obviously is going to depend on the options that we're looking at. We're looking, like I said, with different countries. We're also talking to the Chinese government, obviously. So we will be doing whatever we need to offer the best consular service we can. But it's a very dynamic situation. I wish I could answer all your questions, but before I can answer your question, we need to talk to them. We need to figure out all the options, the best option, and then we'll come back to you.
Je pense que la question, M. Champagne, c'est Mme Rayou dit il faut évaluer la condition de ces gens-là, voir s'il y en a qui sont malades. Je pense que la
You're
question,
saying
c'est
you
s'il y en
need
a-
to look at their condition.
Ça va faire partie des discussions,
Will
évidemment.
you be repatriating people who are ill? Well, certainly that will be part of the conversation, and the minister will be looking at that. As I said, it's the middle of the night in China, so there's some information we have, but there's other information we have to secure from those individuals in order to determine what the best way to help them is. And that's exactly what we're doing. Well, we'll see. I can't speculate as to the best method. All I can say is that out of 126 people who have asked for assistance, obviously there are cases that are different one from the other. So we're identifying what the people have asked for and looking at all the options that have been proposed, talking to the Chinese authorities to get the necessary authorization, and after that we'll be able to tell you exactly what our plan is to bring them back.
Est-ce qu'on parle d'heures avant un rapatriement ou on parle de jours, de semaines?
Are we talking about hours or days?
Commenter le cas de Raïf Badawi qui serait transféré à l'hôpital en raison d'une grève de la faim et d'un état de santé qui se détériore.
Alors, sur la question du temps, écoutez,
So,
ça va
on the timeline issue, it will depend on when we've had an opportunity to speak to these individuals and determine what the options are. I can't talk about the timeline because it's a dynamic situation. Our latest information is that it's 126, but that could change between now and tomorrow. It's a dynamic situation, so what's important now is to contact them, determine their needs, look at the options, and provide consular services.
Second question, please.
Sur le cas de M. Badawi,
In the case of Mr. Badawi, you know that all consular cases are a priority for the Canadian government. At every opportunity, we have argued with the authorities in Saudi Arabia our concern about the conditions in which he's being detained. And as Canadians and with Quebecers, we all want to see him released. And at every opportunity, we are asking the Saudi government to proceed with.
You say you may send a plane or hitch rides on other planes. What's the timeline of making this decision? Because we've not had some of these details in English
so
yet.
I will provide that. So the first order, as the minister said, is to be in touch with the individuals. Last time I checked the numbers, it was 126, but as you would appreciate, this number may have changed since the last time I checked because more people are registering and more people are calling in to our operations center. So once we have the number, we will contact them, assess their individual needs, look at the options we have in front of us, tailor a response that would be a Canadian response to offer the best consular services we can. And the Minister Haidu and I and Minister Blair will come back to you as soon as we have more details. But now what we need to do is talk to these people, assess their situation, look at the options, propose a plan, and we'll come back to Canada.
Champagne, what's the Canadian position on Donald Trump's peace proposals today?
So The question around what happens when they come back to Canada, those are exactly the details that our departments are working on together. We are, this is of utmost priority for me, is to make sure that we're protecting the health and safety of Canadians, whether they're abroad or whether they're here. And so we're working right now with our officials to develop a plan, and that's why we'll come back to you as soon as we have that plan to give you the details. You know that I've been committing to you full transparency, and that is exactly what I'll continue to provide. But I'm not going to, at this point, speculate about what kinds of measures might be in place, because we still need to assess the needs of the people that are in China, and also what capacity we have at a national level.
Mr. Champagne, what's the Canadian position on Donald Trump's proposals for the Middle East?
I'll answer. Just give me a second. We'll and I'll go to do, and then we're.
Maybe if we could finish the coronavirus, and then I will leave you, Minister Champagne.
It's not a question of going in an orderly fashion. I asked the question.
Well, I have a question about the coronavirus in British Columbia.
It's not my topic here at the press gallery.
Okay, maybe we can start with La Presse Canadienne.
What can you tell us about the coronavirus, that new case in British Columbia right now?
Right. So, first of all, I spoke with Minister Dix earlier, my counterpart in British Columbia, and reviewed the case with him. The case is similar to Ontario in that the person traveled from Wuhan. He had no symptoms. When he arrived home, he began to feel ill, and he reached out to his healthcare provider. But given that he had undergone all of the information at the airport and knew what to do, he also advised his healthcare provider that he had recently visited Wuhan, which allowed the infectious disease protocol to be placed in the clinic that he visited. And now he's under isolation and being observed for further worsening of his condition. The national lab has not confirmed the case yet, but we are very confident in BC's lab.
Do you know yet if he was on the same flight as the people who were in Toronto, or is it completely different flights?
My understanding, it's a different flight. I will also say, to answer the question about quarantine and isolation, I spoke about this earlier, but I do want to be very clear that quarantine is only appropriate when people are asymptomatic, and right now there is no evidence that this disease is spread when people do not have symptoms. So isolation is a situation that occurs when people have the symptoms, and he is isolated.
Mr. Champagne, what is the Canadian position on Donald Trump?
So I would say, as you would appreciate, under the circumstances, I didn't have a chance to look at the plan yet, but we'll come back to you. Merci tout le monde.
Peux-tu préciser, M. Champagne, hier,